Finally, we will break the stranglehold that a few big drug and insurance companies have on the healthcare market. We all value the medical cures and innovations that the pharmaceutical industry has developed over the years, but it's become clear that some of these companies are dramatically overcharging Americans for what they offer. They sell the exact same drugs here in America for double the price of what they charge in Europe and Canada. They'll push expensive products on doctors by showering them with gifts, spend more to market and advertise their drugs than to research and develop them. And when a generic drug maker comes along and wants to sell the same product for cheaper, the brand name manufacturers will actually pay off the generic ones so they can preserve their monopolies and keep charging the rest of us higher prices. And we just don't have to stand for that anymore.
What sort of commercials speak out to you? Which ones are interesting?
Showing a bunch of guys in their 50s going to the bathroom. I thought it was funny.
Who does depression hurt? You know, I remember that one, but I don't know if that's for a specific drug.
Cymbalta. If you've been suffering and you see something that may help you, it is natural for you to want to inquire about it.
I'm not sure. I'm not really sure what any of those commercials are as far as being effective are, because you do whatever your doctor tells you, not what the TV tells you.
Attention that's been paid to DTC has been going on for some time, and the incoming administration and their interest in health reform, I think that's going to keep DTC on the hot seat for a while.
There'll clearly be a lot of noise about DTC in this new administration.
No question, the volume is going to be raised, and we have to deal with the new administration who has stronger views on what is good and what is bad advertising, what's proper.
I think I'm always concerned that our ability to communicate directly to consumers about health issues could be curtailed.
The problem with the criticism of direct-to-consumer advertising is that the critics are very long on rhetoric and very short on data.
At some point, it'll be brought to bear that the pharmaceutical industry is only about 10% of the overall healthcare puzzle in terms of overall cost.
As the Obama administration figures out their priorities, certainly healthcare is at the top of the list. I know certain congressmen and certain senators have DTC on the radar, but I really believe they need also a full and balanced look at DTC, not just what they see on TV.
Advertising, forget about the category, is just something people love to hate. So I think it's really the tip of the iceberg. I think DTC is held up because it's the most visible thing.
I don't know how much regulation there actually is, but I get a sense from what I see on TV that there's a lot of it, because there's a lot of disclosure about what the problems might be.
Well, television is quite effective because it reaches to masses. So if I was promoting a product, I would definitely use mass media.
The fear of future regulation is actually more harmful than any regulation that's probably going to come down the pike.
There are two reasons why a moratorium may not happen. One of them has to do with the First Amendment. It's probably unconstitutional.
There's nothing patently wrong with advertising a product, whether it's a drug or any other category.
The second one has to do with the fact that the companies, for the most part, have already agreed to do so. And so there aren't very many ads in the first 6 months, 12 months, 18 months after a drug is approved.
What I think the new administration might do is continue to reinforce our trends towards giving that in-depth information in places where patients can be smart about it.
Provide full disclosure about your clinical trials, product information of things in development, full disclosure to patient advocacy groups, and I think in this economic climate, full disclosure about your financial assistance programs.
You're to create a pharmaceutical commercial. What sort of balance would you put there to try to get someone like you to go to the doctor?
Education, getting anything that would maybe get you to think about it and ask about it is probably the only reason I could see being the benefit.
Something entertaining grabs the attention of a wider audience, but it doesn't necessarily reach the people that are affected by the condition or whatever the drug might be trying to cure.
the issue today in terms of restrictions for DTC in terms of broadcast is that is it promoting the right amount of stimulus towards taking the right drug? Is it increasing unnecessary drug use, for example? And I think that has always been understood as more of a broadcast issue than an internet issue or a point of care issue, for example. So appropriate use of DTC.
In the earlier part of the decade, as we pushed the envelope and pushed the advertising to look more like traditional consumer advertising, I think that is probably when that reaction came to the fore.
What we're seeing now is an inordinate amount of testimonial advertisements. But we're running into a potentially dangerous place where that's all we're doing. And like any form of mass communication or targeted communication, you need to engage before you can communicate. You need to interest before you can educate.
Where we've got to land is that middle ground, where there is still enough information to be educational, but enough entertainment value to be engaging.
As the commercials get more serious and more informational in their nature to the degree that they can, then I think a lot of this criticism will go away.
Essentially, everyone is now programming the media of their own lives, and I think for pharmaceutical companies to stay relevant and not only have a relevant message and a strong value proposition for our medicines, it's really to be where our customers are. And as people tend to fragment more and more in their own personal media mix, we just have to keep up.
Because, you know, it's more convincing when you see someone who's actually experienced or gone through something or can really testify that this really worked for them. It gives you a little more sense of maybe I could try it.
Advertising is the starting point. Then you talk to your doctor, you try it, you talk to friends, you look at studies. You know, it's just a starting point.
What would a TV commercial possibly convince you to do, though?
You can make me red flag it to think to look it up and ask questions about it.
The patient is a part of the solution. Keeping people healthy, keeping yourself healthy is going to move to being more of, to include the individual responsibility as well as the system's responsibility.
Patients, because of the managed healthcare system, because of their own increased knowledge, because they've sort of realized that they understand a lot more about health than they used to, are not going to accept restrictions that take away their access to information.
Given the context of this new media, the more selly you are, the less effective you are. So I think, you know, in the sense of how we impact those conversations in a positive way for the industry's image, as well as the best utilization of those media, you know, an educational approach is the right way to go.
Start to look at unbranded disease awareness, help providing advertising, not only as connected to an individual product's return on investment against consumer media. And if you're saying you need to understand this affliction better, and we're a company that wants to help you understand it, you can find out more here. Maybe that's where you get into a brand discussion once the interested has engaged, or simply find out more about it. It's an important discussion to have with your doctor, and that pharmaceutical company is getting credit for that. Then I think you've got something that makes sense.
You need to really engage consumers in a different way so that when they see the advertising, they say, oh yeah, that's from that great company, or oh yeah, that's that great brand I heard about.
The most important thing that could change the face of DTC and the industry is approval of drugs.
And continue to educate more and finally getting the word out about how pharmacology actually reduces healthcare costs. Virtually everybody in the DTC industry understands that, but that's not been well communicated to the population at large.
For the past 5 to 10 years, having information available online is a mandate. It's what the American consumer expects.